And welcome back. Does your wrist hurt from maybe typing all day, or do your thumbs ache from texting and doing social media all the time on your phone? Well, you could be suffering from carpal tunnel syndrome.
Joining us now is hand, wrist, elbow, and shoulder specialist, Dr. Jeffrey Budoff, with how he can help to ease the pain in your hands and wrists. Welcome, doctor.
Thank you for having me.
Okay, so carpal tunnel. Are there misconceptions about carpal tunnel?
I think so. I mean, just starting with what the carpal tunnel is, it's a space right here in your wrist where the main nerve, the median nerve to your hand goes, and there's 9 tendons that move your fingers and thumb that go there too. The problem happens when you get a space problem. You get too much stuff in too little space, often because those tendons have a lining, and the lining thickens due to age, or you have a thyroid problem, or there's some medical issue, or you have trauma. For whatever reason, you now have too much stuff in too little space.
And we're seeing the picture of some of the nerves that connect in the hand. What are some of the symptoms if someone has been developing
like
carpal?
Texting thumb.
Yeah.
How would you know there's a problem?
Okay, when the nerve gets pinched, you get this numbness of your hand. Some people say it's tingling, or my fingers fell asleep, or it's this painful numbness like when your foot falls asleep. It's really annoying, and they shake out their hand. It's a problem, and it gets worse.
Do you have that like all the time?
Eventually, yes, you do, because it gets worse. But when you start out, usually it's at night, like you're sleeping and you wake up at 3 in the morning and your hand is on fire and you're shaking it out. Or when you grip and you increase the pressure, like if you're driving or holding a book or using tools, then it just goes numb and it's tough to hold things because it starts to bother you.
So I assume someone would have to be diagnosed with carpal tunnel syndrome first, but then how would it be treated if there's an issue?
Well, you want to diagnose it, you want to see a hand surgeon, make sure it's carpal tunnel. That's the most common cause, but not the only cause, and you want to make sure that's what you're treating, because if you treat something that's not carpal tunnel, right, it's not going to get better.
Do you see that? Do you see people who have been
I do that. Yeah, I see that constantly. Yeah, you really want to see a fellowship-trained hand surgeon, a subspecialist. And often, once we diagnose it, we'll treat you to start with just splints. Just wear a splint at night. We'll get a nerve study. It's not the answer to exactly what it is, but it's a big piece of the puzzle. And a lot of people, if it gets worse and it's just driving them crazy during the day, a lot of times people have it released surgically.
Are you seeing more and more cases, though? Because we're all on cell phones and using our hands nowadays differently than we would have used them, say, 10, 15, 20 years ago.
You see a lot of it, and the thing is the word's getting out, which is good, because like anything else in life, if you catch it early, things go a lot easier than if you don't catch it early. So people are coming in earlier, and they're getting treated easier.
Also, you told me something, doctor, before the show that surprised me, that a lot of people with the syndrome, it's actually genetic?
There's a very large genetic component to it, yeah.
That's so interesting. So if someone you know related to had it, then...
Yeah, well, it doesn't always work like that. I have green eyes and my wife has green eyes. Most of our kids have blue eyes, so it doesn't always work just like that. But yeah, very high genetic component to it.
Do you just have problems, though, like when you have carpal tunnel just in the wrist and in the hands, or would you start feeling it like coming up the forearm into the elbow and shoulder?
It can shoot up. About 20% of the time it'll shoot up to the elbow. 5% it'll actually shoot all the way up to the shoulder. You just get this electricity just going up and down.
My wrists are hurting just talking about this.
Like my wrist and thumbs, I'm like, what can you do, though, to avoid it?
Like
or
hand exercises or something?
I'm just considering doing this.
Those don't work real well.
Okay, I'm not going to do that.
No, if it gets bad, basically the best way to treat it, I think, is an endoscopic release. They used to do these releases that were up the arm, and that's a little bit much. You don't need all that. Then they went to this mini open, which is better, but the least invasive that gets you back the quickest with the least pain, the least problems, is endoscopic. And there's a couple flavors. There's 1 incision, which is the least invasive, which I prefer, or there's a 2 incision, which puts an extra incision on the hand. It's not rocket science. If you put extra incisions and do extra surgeries.
Longer.
Exactly.
But you're not actually cutting open people's hands anymore. You can actually just make a little hole and go in.
Exactly correct. And we just do it with a fiber optic device, so I can see under there through a small incision right here. We don't go near the skin on the hand, and we just cut it from the inside out.
What's the typical recovery time if somebody has to have surgery?
Basically, we use a super glue type substance to seal it so you can shower immediately. Just don't get it dirty or submerge it underwater for about 10 days, and you can do what you want. Now, it's minimally invasive. It's still surgery. If you want to minimize pain and swelling, try to avoid heavy gripping and lifting for about 6 weeks. If you don't mind, you can do whatever you want to do. You just sort of pay the price.
And Dr. Budoff, though, if someone is having the early symptoms, though, of carpal tunnel syndrome, it doesn't mean always that they would need surgery, right? There are ways to avoid it.
No, if you, it does tend to progress over time, but usually we just start with a splint at night, and that can help the symptoms for a prolonged period of time if you catch it early enough.
All right. Well, Dr. Budoff, thank you so much for stopping by and having the conversation. If you guys would like to learn more about carpal tunnel syndrome and how Dr. Budoff can help you, you can visit rearmyourselftexas.com.
And coming up next, we're having an artist